The broadcast is now starting. All attendees are in listen-only mode.
Welcome to Brokers on Board and other resources brought to you by the Small Business Health Collaborative and Health and Disability Advocates. My name is Barbara Otto. I'm the CEO of Health and Disability Advocates, and we are a national nonprofit who is headquartered here in Chicago and has been working on access to health care issues for people with disabilities and older adults for 22 years. We have been really engaged, as you can imagine, on the Affordable Care Act and implementation of health care reform, not only nationally, but locally and here in the state of Illinois, and have been very engaged in thinking about the long-term view of healthcare reform. How do we begin looking at building a pipeline for access to health care that is going to work for all people, which is, of course, what brought us to working with partners like the National Association of Health Underwriters and, of course, the state chapter, the Illinois State Association of Health Underwriters. And I'm thrilled that both Pam Mitra from NAHU and Russell Dixon, the president-elect from the Illinois State Association, are on with us today. But another big realization I had early on in trying to reach small businesses is that I really needed to be also connecting with brokers who have had experience in working directly to help small businesses connect with healthcare, which is what led me to Michelle Thornton. Michelle Thornton has been working with HDA since 2013 to try to effectively build paths to coverage for low-income people who are eligible for the marketplace. And so I'd like to have Michelle Thornton introduce herself and talk about her breadth and experience before we start the webinar. Michelle?
Thanks, Barb. I appreciate the introduction. To fill everybody in a little bit more on who I am, I know that I've met a lot of you that are joining us today, but for those that I haven't, I have been a health insurance broker since 2000. I do work for my family's business here in the suburbs of Chicago and have been a long-standing NAHU member as well. I have volunteered through my board locally in my chapter as well as at the state level. I have since 2010 kind of taken the view that the Affordable Care Act and healthcare reform was coming and tried to leverage unique opportunities I had been given to keep brokers involved in the game and build some bridges between maybe some unlikely partners. And I think that when I heard about this opportunity with Health and Disability Advocates to get more accurate information out there to small businesses, I was very, very excited to be able to do that. I think that the webinar today is going to highlight some of the things that have come out of that in terms of really understanding that the best way to work with small businesses is through the broker community. So I'm looking forward to sharing what we've been working on.
And before we start, just a word about the Small Business Health Collaborative. The Small Business Health Collaborative, as I said, is a collaboration between the Campaign for Better Healthcare, Health and Disability Advocates, and the Small Business Majority. We are funded by nonprofit foundations in the state of Illinois. So the services and supports that we are able to put forward to work with producers and brokers are of no charge for producers and brokers. We are doing this because we want to see more enrollment and more of a path to coverage for people. So I'm going to turn it over to Michelle. And throughout this presentation, there will be some polls. We hope you participate. And right now, your lines are on mute, but at the end of the presentation, we will unmute the lines so we can take a few questions. So thank you very much.
Okay, thanks, Barb. On my slides, we're still on the main slide. Are we forwarding? Okay, there we go. We got the agenda. So I think we've gotten a little bit of an idea of who Small Business Health Collaborative is. I'll talk a little bit more about that. I'm going to focus specifically, though, on health and disability advocates and the work that we've been doing with producers and brokers, starting with sharing some information that we gained out of broker focus groups that were done in the fall, introducing or reintroducing, to some of you who have seen it, something we're very excited about, and that's Brokers on Board, our digital hub, and give you a little bit of a sneak peek at some other resources that we have available and what we kind of see coming in the next 12 months. And lastly, we hope that we would get some feedback from you on kind of what we're doing and answer any questions that you have. So I think that Bart gave us a really good sense of the Small Business Health Collaborative. Again, the 3 organizations that are working with the collaborative, Health and Disability Advocates, the Small Business Majority, and the Campaign for Better Healthcare, are all kind of trying to pull in the same direction to reduce the number of uninsured working poor. So this really, since we know that that working piece, small business, was really kind of a natural fit in terms of how to get in front of them. A big part of it is trying to provide accurate information and educate the businesses, and then through the businesses, their workers, about the ACA. And then more importantly, that once they've got that information, make sure that they understand what to do with it, and in giving them clear direction and the constant message that the place to go at that point is broker. We also recognize and have lots of connections to the ACA Navigator community and other organizations. We want to find ways to build better communication and bridges between the broker community and them, just again, all for the same purpose of trying to meet the needs of the uninsured. So some of the first activities that were taken as of last year was doing a number of educational events. These were both in the form of webinars as well as in-person events. We had a pretty strong partnership with the City of Chicago, but also with organizations like Enroll America, where we did some collaboration, and a number of other Navigator and Get Covered Illinois related groups. We have developed lots of online resources, both the website that you'll see today, as well as putting out information through our blog. We also have really been trying to connect with HHS and Hawthorne here in Illinois to make sure that we have all the up-to-date information about the shop, that we were working with them on their early access promotion, and that we try to act as somewhat of a conduit to make sure that brokers in the state are being included in that as well. So the main, my main role in the fall was to conduct, well, I guess recruit and conduct some broker focus groups to try and really make sure that what we were thinking wasn't the opinion of me, Michelle Thornton, health insurance broker, but that we had a broader perspective on what some of the needs were out there, and kind of provide some feedback both to the state of Illinois, Get Covered Illinois, as well as higher the chain with the federal government, and then make sure anything that we were developing would really answer the needs of the brokers and be a value add, not so much just something that was one of my harebrained wild ideas. So we did identify brokers through the Illinois State Association of Health Underwriters and through the GCI Broker Finder tool to identify perhaps people that were certified but were not state members of the Health Underwriters Association. In the fall, we had 2 initial groups, 5 brokers in each group, and we got a lot of rich data out of that. To give you an idea of what some of the themes were that started to emerge in terms of what were ways that our collaborative could help support the broker community. The first one focused around additional education and tools and resources. I think that for many of us, we rely heavily on the National Association of Health Underwriters and the State Association for education, for our monthly meetings and things like that. So what we saw, though, is a way that we could kind of build on that was creating really easy-to-use tools that would be sort of, that would supplement and kind of fill the gaps of things that perhaps NAHU had not provided, or that were not maybe as customizable. So things like decision support tools that consumers could use to figure out if it made sense to purchase individual or small group coverage. Presentations. So this was something we've been doing a lot of, both webinars and in person. So how could we pass those on so with kind of good vetted information so that brokers who are being asked to do presentations by chambers of commerce and their Rotary clubs could have something ready to go that they didn't need to waste their time putting together. That was Illinois specific. So again, I think that there's resources, a lot of resources like this at the national level, but we wanted to make sure that what we were offering was specific to the on-the-ground community here in Illinois. We also just recognized that we didn't have all the answers either, and so there was kind of this important message that came along about ways to get questions answered, and that there was kind of this barrier to that with both the marketplace and Get Covered Illinois. And so the message that I kept hearing over and over is, how can we connect better and get questions answered quicker? The next two kind of theme areas that emerged out of the focus groups, next three areas were finding ways that as a broker community that we could pool our resources and leverage technology. So this was some of the suggestions that came up were just, kind of trying to find ways to better make our businesses move into a more efficient virtual format using mobile apps, ways to like link websites, short videos, YouTube spots, things like that. There was also kind of, again, this need for some kind of, rapid-fire technical assistance that was quickly and easily accessible. And then finally, the opportunity to network both with other brokers, but also with navigators and just kind of other people that were out there doing the kind of work that we're talking about. So hearing kind of those pieces of information, that we were looking for more education, kind of better technology to support our business models, and networking, one solution tool began to sort of quickly come about. And part of the reason is an easy one. Health and Disability Advocates had participated in another collaboration that created a what I would call, it's almost like a social media tool, essentially, kind of like a Facebook or Twitter site for navigators in the state of Illinois. And that was called Help Hub. And it was something that was very unique to Illinois and had gotten great traction amongst the ACA navigators in terms of ways to get questions answered by industry experts. And that model, we believe, could be a good fit for the broker community as well. So what we found is that in our conversations both with the focus groups as well as kind of a little bit more deeper dive in with some of the leadership at Illinois State Association of Health Underwriters, that creating something like this where brokers could come together to either get questions answered by their peers or from representatives from the professional organization or from the state of Illinois is really kind of the vision that we started to have. And that's what led to the creation of Brokers on Board. This is the website here, so the http://brokers.hdaadvocates.org, and a screenshot of what you'll see when you type that in. A couple things that I will note about this is that you do have to sign up and create a profile on the site. There is no, again, as Barb mentioned, there is no cost to do so, but you do have to kind of go in and put your general information in. And again, I refer to it as kind of like a Facebook for brokers, although certainly people aren't posting pictures of last night's dinner or their vacation or anything of that sort. It is meant to very specifically focus on the work that we're doing. So on that, once you've created kind of your login and information, you have the ability to see your own profile. And so that toolbar across the top highlights the different places you can go. What we just ported through is if you clicked on the profile kind of tab. So you see here I am, and you have the opportunity to not just put your name, but also a photo of yourself. and your contact information, some general facts about who you are. One thing we wanted to make sure that we were focusing on is both the people that are signing up, are they health insurance agents and brokers, or are they coming from another area? Let's say they are somebody from the Department of Insurance or somebody from Get Covered Illinois. We wanted to be clear about the folks that were answering questions or posing those questions, where they were coming from. We also wanted to know if they were members of the Illinois State Association of Health Underwriters. This was really important to us that we saw this as a partnership between the professional association here in Illinois, as well as our collaborative and the broker community. I will note, and this is, I think, just important, that although we asked this question, you are not required to be a member of the State Health Underwriters Association to use brokers on board, but we are promoting it as sort of like a value add to that. Part of the reason is that we do, and we'll see this here shortly, we think that this might be a way to get more members involved in the Health Underwriters Association and make sure that we include information about how to become a member, chapter meetings, all those kinds of things. But we didn't want to sort of block the people out of using this tool because they had not become members yet. All right, so when we go back to the next item on the toolbar is messages. There are ways on Brokers on Board to directly email back and forth to one member. So while the majority of this is focused on kind of a public-facing message board format, you can see here that I do have a message waiting for me from Bryce at HDA. So there is a way to just kind of email back and forth directly. So let's say I have a very specific question for Pam Mitchoff and I don't necessarily want to make that public. I can go ahead and just, basically email Pam directly from this and then get a response back and forth. It's a private message. All right, so this, just to kind of orient yourself, we're back at the home page now. Along the top toolbar, you see, I think what really is probably the richest piece of this, and that's the forum. So if I were to come and kind of hop on Brokers on Board and I wasn't exactly sure, never been there before, wasn't sure what I was looking for, just wanted to kind of take a tour, this is the place that I would start. And I would click on the forum tab on the toolbar. So for now, we have 4 main forums. And so this is topical areas of conversation that we've thought that were relevant to the broker community in the state of Illinois. That being said, this is very modifiable. So we can create new forums, we can remove them if they don't seem to be getting any traction. But really, this is at least our starting point. So, but also definitely a good area for feedback from you guys. So our first 2 forums are individual and family health insurance, and those are then broken up into different conversation threads amongst that forum. So right now, we have 2 different threads going, one about the health insurance marketplace and one about Medicaid. Now, in terms of if you've got kind of thinking about the organization of this, we have this forum topic of the individual and family health insurance. We've got 2 boards done, one about the marketplace and one about Medicaid. And within each of those boards, then we have different, conversations going on. And I'll show you some examples here in a second. But it's a way to kind of try and categorize and keep the information easy to find and follow. But again, whether it's the forum or the board, we can kind of take suggestions on how to organize those, but the threads themselves are all user-generated. Second forum is about the shop, and then, sorry, Barb, about the shop, and then we can go on to the 3rd and 4th forums. So the 3rd one is professional development, and this is where we have all sorts of good information about the Health Underwriters Association and about training and certification in general. So an opportunity to ask questions about registering with the FFM and with becoming a producer partner of GCI, things like that. As well as we did include an area for continuing education, although you can see there's no current threads or posts. But basically, questions about doing, being a broker, keeping your license maintained, how to kind of leverage the different tools that are out there for that. And then the final forum is just general. This is where events can be posted, although I'll show you how those wind up on a much easier to follow calendar. And then just questions about this site, basic technical kinds of things. All right, so as I mentioned, the content is meant to be user-driven. So while there are some things that, that the identified moderators are posting, it's really meant to be created by the members. So under the Small Business Health Options Program, or the SHOP forum, we have a board about employer compliance. And you can see here that, that there's one thread under there. We can tell that Pam posted at the end of January about employers not being required to report. So this certainly is something of interest to me. And I might see this and be like, oh, I got to see what Pam had to say about that, and I would click on employer compliance. At which point, we can see a couple of important things here. So we can see who has replied, how many other people have viewed it, and who else has posted. So you can see that I've got a post in here as well, replying to Pam's posting. If we click through then, here is Pam's original post, and it says that, you know, you guys can all read this, don't need me to read it to you, but basically an update on the ACA requirement for employers to report coverage, and very kind of clear, direct clarification about this circumstance, and again, as well as who posted it. You can see below my reply. Pam, thanks for the post. Do we know if NAHU has any good accountant-focused tools or fact sheets? At some point, Pam may choose to respond back with a link or some sort of a PDF document that can be used, you know, in this kind of circumstance. Or somebody else might. Let's say another broker says, hey, Michelle, Pam might not have answered, but this is what I found that's awesome, and link me to something along those lines. All right, so again, now we're back to the home page here, and you can always get there on that kind of top left tab. And I would basically say that if you don't want to kind of just take this general approach to scrolling through the form and see what's out there, and you know you have a very specific question, you can use our search box here on the home page as well. And what this does, you know, by typing in keywords, it allows you to search more specifically for what you're looking for. So on this particular example, I am looking for information on the GCI Producer Partner Program. So you type that in, hit the search button, and then basically any post in any forum that's ever come up talking about those words, the GCI Producer Partner Program, is going to come up for me to take a look at and see what really makes sense. So Emily's post here has, I think, what really kind of showcases one of the benefits of this in terms of she has listed the steps to becoming a GCI producer partner, but you can see there's 5 different links that she provides within that in terms of fact sheets, the website, email addresses, who to contact. It's very, very streamlined and easy to find in one place. And again, it's, you know, actionable that I can click through to those things that I'm looking for right away. All right, you could also look at this from another way, and that is the search bar on the tab is another way that kind of lets you do perhaps a little bit more of a specific search. So I'm not going to show you an example of that, but rather than just using keywords, it could allow you to see, for example, any posts by Michelle Thornton. You can pick the author, or you can limit it by time frames, different things like that. All right, so we're going to take a quick look at the calendar function then. And this one, I want to be very clear that the calendar function is allowable for anybody who's a member to upload events on. So if you go ahead and you click through to the calendar, you'll see a pretty kind of easy, user-friendly view. Right now, this is a look at March. We've got 2 events on there right now. The Springfield Legislative Day, and then the SAHU monthly meeting. When you take if you link on those, and I think that I've got a screenshot on the next slide. Yeah, So this is about the legislative day, and we've got some details here. I posted this about the registration before and after. And then I think this is a really good example, too, of where we have uploaded a PDF, and that's directly like the flyer from the day. So this is just in terms of the state chapter or other local chapters, another opportunity to have the messages that you're doing about events, about webinars, things like that, communicated broadly to the broker community. All right, and finally, when we think about trying to get a sense of who the members are and using this to kind of meet the need that people were talking about in terms of networking, we also have, for anybody who has signed up, you have the ability to search through the member listing as well. So if you click through on this tab, what you'll see is a listing by name, username, when they've registered, and through here is the easiest way to search for certain people and then to be able to private message them as well. But you can also from here then link to their profiles and see where they work and see what they're doing, all of those kinds of things. All right, so that concludes the first part that we're going to talk about today in terms of Brokers on Board. But the other thing that we do is through Brokers on Board, we have a direct link to our the website that we use to provide all of our web-based resources outside of Brokers on Board, and that's Illinois Health Matters. So on the bottom of our homepage, you can click through there. You can also get to Illinois Health Matters just directly with IllinoisHealthMatters.com, or follow it on Twitter at Illinois Health Small Biz, or IL Health Small Biz, rather. So this is really, I think, kind of gets to the second piece of the resources that we are creating for not just brokers, but consumers as well. So we're going to do a quick tour of what's available there and give you some sense of some other things that we've got going on. Okay, so when you get to Illinois Health Matters, across our toolbar, this is organized by consumer group, really, or I suppose interest group. So while we do not have a specific broker tab on here, that's again what we're using Brokers on Board for. I think for the majority of what we're going to talk about today is through the small business site, and we really believe that all of the information coming on the small business site, again, leads consumers directly back to brokers, but also is really good resources that brokers could use themselves to pass along to their clients. So I'm going to kind of share with you a few of the different pieces that are here. But this is, again, once you type in the IllinoisHealthMatters.org, you would want to hit the Small Business tab along the toolbar, and this is what you'll see. All right. Again, I guess we're just focusing on here. This site is, the Small Business site is another product of the Small Business Health Collaborative, but we also have sort of reached out and added a lot of other partners in to help us develop material for it and provide blog entries and postings. So one thing that I think that you might be interested in taking a closer look at is our case studies. So this is an example, just for starters, of 3 different small businesses. And the different businesses themselves are fictitious, I guess, to start with. And we talk through basically how different businesses might make the decision to either begin offering group health coverage, either inside or outside of the SHOP marketplace, or if they should allow their, or recommend that their employees get individual coverage, not offer coverage right away, things like that. So we're going to take a look just to kind of give you an idea of the depth of the information on these case studies. At the first one, which is timely, certainly going into the beginning of March, with an Irish pub, Dublin restaurant and bar. So we'll take a look at what we've got there about that. So in the case of Dublin's, we talk about the type of basically the type of business it is. We know that it's fewer than 50 full-time employees. And again, I want to reiterate that under the steps here, we really continue to reiterate that that this is best explored with the help of a broker, and we want to make sure that that is constantly reflected in what we're doing. If you were to scroll down on the screen, you would see on our next screenshot that we go beyond just kind of like the general information descriptive about the steps that they should take, but we also outline how many positions, what the approximate payroll is for each. We start talking through determining full-time equivalents and whether or not they meet the requirements based on what's expected for the small business tax credit in the shop and things like that. So they're very detailed, the case studies, and they definitely would be something that would take a little bit of time to go through, but we do have links to connect out of them to, again, make them very, very useful for businesses that may see some similarities between themselves, and it'll kind of give them a sense of what's best to do, and then find ways to connect with brokers to talk about them. Okay, so this is back then on the home page for the small businesses on Illinois Health Matters. In this section here, these are some of the PDFs that we encourage you to download, pass along to your clients. These are all PDFs that are, generally speaking, fact sheets. And so I think that we're going to show maybe a couple of them, give you a sense of what we're talking about here. First one, right, is a fact sheet about the employer FLSA notice. And so this one, was one of the earliest ones that came out, but also kind of helps employers understand where they need to be compliant with this, how to do it, and how to find help in doing it. Another fact sheet, and I think this one is one that I was very excited to hear that that our partners are looking for, and that is for maybe an individual or a business that has never worked with a broker in the past. What do they need to do to plan for that first meeting? So we created a checklist about things to bring with, either about your company or about yourself, stuff like basic facts, your tax ID number, any details you have regarding your current plan. And again, this is something that we are encouraging consumers to do, is to kind of get prepared and be thinking about what to do next when they're going to set up that meeting with a broker. So there are two other ways to kind of connect or get information from Illinois Health Matters. The first one is our blog, and then the second one is through all sorts of social media. We will take a quick look at some recent blog posts and kind of get a sense of what information is there. This first one that's coming up is some information regarding an article that was in Health Affairs in January. Again, our blogs typically link directly to the initial information, where things are coming from, and try and really distill it down so that if I'm either a broker or a consumer, that whatever we're talking about is easy to follow and kind of connects us to broader information about that. This part of the site is where we are constantly looking for guest bloggers to join us. I post in here about once a month, but we've also done some recruiting from the Health Underwriters Association to get some additional articles up, and as well as from the business community. And so we are, and we actively promote these outside of ours through social media and through our contacts in the media, which Barb will talk with you a little bit about at the end of our talk. All right, so thinking about what we've got coming up, really for this year, our goal is to create as much awareness and usage around our Brokers on Board and small business website as we can. We really value the partnership with the health underwriters in Illinois, and we'll continue to be attending meetings and talking about what we're doing and running this particular webinar on an ongoing basis to get other members to be able to see what we're doing and kind of share with them information about how we're trying to engage the broker community and really best support them. I think otherwise when I'm thinking about plans for this year, things that we want you to know that we are planning for, that I think we are actively trying to maintain a good relationship with the folks at Get Covered Illinois. There's a lot of transition going on there, and so obviously with the new administration, so making sure that the new leaders at Get Covered Illinois, in whatever form is that continues to exist in, are aware of the work that we're doing and engaged as well. We did have a commitment from the prior director of Get Covered Illinois to help us staff one of our forums with the Get Covered Illinois staff. And now we are, now that she has announced her departure, we are actively engaging with the new interim director to make sure that we can get some, keep that communication channel open as well. There's also a few things that we learned from the focus groups that we haven't acted directly on yet that are still coming, and that is going to be having that customizable presentation available. We are developing some video vignettes that will be, so right now all of our tools on Brokers on Board and the small business website are really sort of paper, word-driven. While they are interactive in terms of being able to link places, we don't have any content as of yet that is video-driven, which is something very important to us, both in terms of sharing messages, sharing things on social media, and being able to highlight brokers. So you can expect to see some broker interviews, things like that. This was really one of the biggest things that I heard that felt like a missed opportunity from the brokers in the focus groups was that that the marketing from GCI just didn't highlight brokers enough, and so that we could really leverage our position to highlight that in a better way and encourage brokers to share on their own social media and pass along to their clients. So we're excited about that. We will continue. Right now, the state navigator grants in Illinois are coming to a close over the next couple of months, so you'll be hearing more from us about some ideas that we have in regarding building some bridges between the navigator workforce and the brokers, possibly to create some mentoring, to create some opportunities for navigators to enter into and become licensed as brokers. That's another thing that we have some interest in. And then doing just some ongoing media blitzes to make sure that we are engaging our media partners with what we're doing as well. And I'm going to let Barb talk about that. That's really her area of expertise, and I will pass it on to her.
Great. Thanks, Michelle. And what you're seeing now right in front of you is sort of the cover page of the presentation, the boilerplate presentation that we've built, that we'd be happy to post on Brokers on Board, and brokers are, able to take out that small business health collaborative piece and put their own brand there and put their presentation in there, and maybe even go ahead and customize by putting the logo of the organization that they're doing the presentation for. So this is just a screenshot of that. A big piece of what we do at HDA and how we've approached the work that we've been doing with producers or brokers and small businesses is really by learning directly from them about how they'd like to most receive information. Michelle did those focus groups so we could learn best how to work with brokers. We also did a survey. We teamed up with Crane's Chicago Business, and we learned that 80% of businesses learn about healthcare reform or learn about employee coverage through brokers, and that just was the icing on the cake for us when it came to how we needed to be working more with brokers and engaging brokers in the effort to help Illinois consumers find a path to coverage, whether that be through the Affordable Care Act in the marketplace or otherwise. So one of the things that we constantly do as an agency is try to engage the media and try to engage in thought leadership in helping frame a larger discussion about a path to coverage. And I'd be happy to share this survey. I think there's some really interesting insights for brokers on what small businesses are thinking, and that'll be one of the things I post this afternoon on Brokers on Board. So you'll be able to access it through Brokers on Board, and it's also on our webpage on Illinois Health Matters on the Small Business tab. We do a lot of work with the media. This is a story we did with Chicago Tribune, and I think those of you who know Robert Slayton, you'll see that that's a photo actually of Robert sitting down with some clients. Robert, of course, has long-standing relationships, as does the Illinois State Association, Russell, and the National Association of Health Underwriters as well. But we've really tried to focus our media contacts and turn them over to brokers, because I think you'll see in my quote where I was in the Tribune that, look, I'm well aware that brokers and producers are what's going to be here long after the federal government is putting funding into the state of Illinois to fund navigators and otherwise. I've always viewed the broker community as where we needed to go with targeted materials and resources, because you existed before the Affordable Care Act and you will be here after the big push around the Affordable Care Act. So as we're trying to provide thought leadership in the media, we're always trying to promote that message. And finally, just here's a screenshot that includes our Twitter handles at hdadvocates.org and Illinois Health Small Biz. And Cranes just recently had a piece that included the fact that the reason why we saw more enrollment in the state of Illinois in the marketplace was due in large part from bolstered relationships with brokers. And we were working with our contacts at Cranes to make sure that they included that information. So this is the conclusion of sort of our formal presentation on the resources around Brokers on Board. Michelle, do you have any other things you'd like to add before I unmute the lines?
Yeah, you know what, my last thing that I will say is that having been a longtime member of the Health Underwriters Association, I know it's a volunteer-run organization. I know that trying to drive membership is always a concern, and I know also that financial resources are a concern. One of the things that appealed to me about working with HDA was the fact that they had funding outside of either kind of using my own commission resources or trying to find a way to get the state association to have to divert membership funds, fees to something like this. And I was just so excited that we could kind of leverage the kind of interest in educating the public in a way that really benefited brokers. And ultimately then, you know, if I think about if I'm a single broker working on my own, if I can use both my affiliation with health underwriters as well as kind of the media contacts that are available by being part of an organization like HDA, or working with, rather, be a partner with HDA, I think that's really exciting, because I know that you know, here at Thornton Powell, we don't have much in the way of a media budget. We don't have much in the way of time and resources to be able to put out press releases. So I'm really encouraged and excited by the fact that HDA has people coming to them to ask about kind of who to talk to and who to get in front of in terms of the broker community and what's happening here in Illinois, and that we can really use that as a way to highlight who we are and what we're doing and the value that we're bringing.
Great. So I am now unmuting people's lines. Do we have any questions? I unmuted you, Pam, just in case you had any quick comments. And Otis.
This is Pam Mitroff. I'm with NAHU, but also I'm a longtime member of the State Association of Health Underwriters here in Illinois. And I think one of the things that we've discovered in working with our members on the Affordable Care Act is that it's a complex and confusing world. And as a result, many brokers feel sometimes that they're just overwhelmed by some of the issues that confront them and trying to help their clients and prospects. And so we're glad that we're able to help with that.
Thanks, Pam. Are there any questions? Okay. Oh, go ahead.
I'd like to commend you guys on what you've put together so far. Something we were asking about 2, maybe even 3 years ago via the state. And I agree with Michelle. It's obviously something that was not a priority, or they didn't have the personnel or funding to do. So this is going to be extremely helpful for me, and I think other brokers. What I wanted to talk about is how are you and how can we help get the word out about brokers so that other brokers can take advantage of it.
Oh, that's really a great question. You know, we have been talking with Russell Dixon about sending out something similar to a screenshot of the threads that we've been having on Brokers on Board, sending it out to the entire membership of the state association. Again, I think promoting it within your individual chapters I think is really important. We did purchase the list from the Department of Insurance, and we have sent out flyers like the one that went out regarding this webinar to brokers. But of course, that list from the Department of Insurance also includes people who sell everything ranging from property casualty to a range of products. So I would be happy to continue posting, like to post a sample invitation that brokers could be sending to their colleagues to invite them to participate in Brokers on Board. And again, remember, you don't have to be a member of the state association. Any registered health insurance broker can participate on this.
The other thing I would, just to add to Barb's comments on that, I think that so far we've done a good job. I've been out to Chicago Southland. Barb has been out to Dahu and talked a little bit about this. And so we've been kind of just starting to kind of get our feet wet with folks about what we're doing. And so we recognize that that there's a handful of other chapters in the state of Illinois. So we really want to make sure that we're connecting with people at Northern and Chicago Northeast and Central and Southern. But also, so this webinar that we did today, we will conduct some additional times. We're also going to have it posted as a recording as well. So, you know, we just really want to encourage you to not only talking to people about it, but also start giving it a try. I think the biggest thing that could create this website to fail is if it's irrelevant, right? So if people aren't actively engaging in it, it's not going to draw them the same attention from the DCI and from the Department of Insurance, from some of the other places that we want people actively involved in answering our questions. So we just really encourage you to start giving it a shot and seeing how it works for you and giving us feedback of how we can make it better.
Great. Michelle, we do have a question. What are the changes taking place at GCI with the new administration that you're aware of?
That's like $1 million question, right?
Right.
Yeah. So the biggest thing that we know, and I think that is definitely public knowledge, is that has been announced. That is Laura Phelan. And Laura Phelan has been part of the DCI team for a while. She was actually working on the marketplace through the DOI before it became in the governor's office. She was a policy analyst for a long time, but really has stepped up to a number of different leadership roles. So my understanding is that she is just an interim position, that there is that a new Governor Rauner appointee coming in to follow her. But unless Barb has heard anything different, that name has not officially been announced yet. So that's the first thing. Second thing that we know is that there is still funding, line item funding in Rauner's budget for GCI. That being said, we have no idea what that is. If that money is left over from the federal grants from year 1 and year 2, how he intends to use it. The rumblings I'm hearing in terms of the Navigator program is that there will likely not be any money allocated to that from a state basis out of that funding, but it's very unclear. So, so I would say that I wish I knew more, but we are trying to, like I said, connect better with Laura and see what we can find out from her before that transition happens, because we do have an existing relationship with her, and anything that we find out, I'm happy to share on Brokers on Board or with anybody that wants to chat more about it offline.
Great. Well, I'm not seeing any more questions. Pam, is there anything you would like to add?
No, there's nothing that I can think of.
Great. Well, I want to thank everyone for their participation today. As I said, we will be posting a copy of this webinar, and we'll put a link to it inside the Brokers on Board. And if you haven't registered, please go register. And thank you very much for your time today, and thank you, Michelle, for the great presentation.
Thanks. Have a great day, everybody.
All right, thanks.
Thank you.